Okay, hello students. Here we go. So for those of you who don't know, I'm Dr. Molly. I've been in contact with you guys for a very long time already, but the day is finally here where you're able to start your clinicals. So I know we've been working on this probably since like the end of summer, and for some of you even before that, to get you into clinical placements. So we still have a couple of little issues to get all of you where you need to be. So a couple of things, just make absolutely sure that I have your preceptor information sheet for all your preceptors. Some of you have more than one preceptor. That's a couple of things outstanding. There's a couple of other little issues that I'm working with some of you guys individually. But I just wanted to give you an overview for the course and how the clinicals are going to work. So the first thing that I wanted to point out, I feel like I know most of you guys already. This is a fully online course. So usually what I do in my online courses, most of my courses are online. So what I do is like this weekly orientation video. But because I have been emailing you guys, you guys are a little bit different because you're my clinical or specialist students that I've been, I'm the clinical coordinator for the program. So, let me plug this in. So anyway, so I feel like I know you guys. I may not have seen all of you guys yet. So now here, this is my face. So if you see me around, this is what I look like. So a couple of things. Let's go to the Blackboard site. And so I will go over that with you. We'll go over the syllabus and I will tell you some expectations of this semester. So I think this is not your first course for most of you guys. You've had some of you, you've had some other courses before you've gotten to here. So, but just in case, let's go over some stuff. So when you go to your Blackboard site, because Blackboard is a little bit new, you know, they did that migration thing. We all had to struggle through the horrors of this new system, and Blackboard kept shutting down, but it should work now. So when you go into our course, it's listed Adult Gerontology CNS Practicum 1. That's your first CNS clinicals. So in this clinicals, you are expected to do about 200 clinical hours, and that's going to be in an acute care setting. Then over the summer with Dr. Saunders, Mitzi Saunders, you're going to do about 100 wellness hours. And then next fall, from like September to December, you'll finish up your CNS clinicals with another 200 hours. And in the spring winter semester, and then in the fall semester, that's when you're going to do your big projects, when you're starting to work in the different spheres that the CNS works in. So this first semester, we're going to look at we're going to have you guys doing some assignments where you are working with patients and families and nurses in those two spheres. And then in the last semester, you're going to do a big system-wide project. So you're looking at it at the system level. What we try to do is coordinate what you're learning in the theory course with Dr. Saunders and have you implement that and practice it and apply it in the clinical setting. So that's how this is supposed to work. So let's go over the course syllabus really quick. So if you look over on the left-hand side where the blue words are, if you click on the one that says syllabus, it will come up as syllabus winter 2019, and also that clinical location grid. That clinical location grid lists, that was that tracking sheet that I've been using since I've been working with you guys over the summer. Make sure that I have all the information correct. I need to make sure that I've got your preceptor's name, their address, their emails, because I email them separately and I send them preceptor handbooks and the syllabus and updates and things like that. So make sure I've got all that information correct so that your preceptors are getting information from me that they need. And then at the end of the semester, I send them a verification letter, because certified advanced practice nurses they need to keep their certification up, and one way they can do that is to precept. So if I can send them a verification letter that they've spent 200 hours with you, they can submit that, and it will help them when they go to recertify, which is nice. So let's click on the syllabus right now. So if you will pull up the syllabus, let's go through that really quick. If you scroll down to page 2, my information is listed there as the clinical faculty. That's my cell phone and my email. It's old hat. You guys all have that. Most of you guys either text me or call me or whatever. But anyways, it's there. Now, I'm the clinical coordinator for the program, which means I'm the one that's kind of been helping you get into your clinicals and getting all the logistics, making sure that you're in ACE and all your compliance stuff is in there. Professor Miller, Melanie Miller, is going to help me as clinical faculty. So what the clinical faculty does is we're going to be the people that are grading your work. So you've got your clinical preceptor, those are the preceptors you're working with in the clinical site, and then your clinical faculty. So we're going to be the people that are helping guide you in your assignments and the things that you are required to do in the clinical setting. So, and then the clinical coordinating role is what I've been doing with you guys since September, is getting you into the clinical program. So I know that gets a little bit confusing. So I will be the clinical faculty for half of you, and Professor Miller will be the clinical faculty for the other half of you. And I will send, we're still working that out because the Blackboard has kind of screwed that up a little bit. So stay tuned on that. I'll let you know who is assigned to which faculty. This course is completely online, obviously, except for when you're in your clinical settings. We've got students all across the United States, so that's kind of fun. So scrolling down, the objectives are listed there, and the objectives are based on the MSN Essentials. So that's important to kind of know as a CNS, what are you going to be expected to do. The textbook, there's no different textbooks than what you're using in theory. So whatever you're using in theory, that's what you can use here. I've also listed Jill Turner. She is the librarian for the College of Health Professions. Her information is on our Blackboard site. Again, if you go all the way over to the left of those light blue letters where it says CNS Library Resources, that's a ton of resources for you guys with the ebooks and articles and things like that. If you ever need any help knowing how to do a lit search or getting full text articles, Jill Turner is your person. She's so good. So all of her resources and everything are listed in that CNS Library Resources, as well as in your syllabus right here. So absolutely utilize her. She's a really valuable resource. So under required equipment, it says that you must have a Skype account or a camera or FaceTime or something. I don't have an iPhone. My children tell me that that's completely egregious, but nonetheless, I only have an Android phone. But I will make contacts with you and your clinic and your preceptors usually just once, like probably midway during the semester, probably in late February, early March. So we can do a conference call or something like that, but we just need some way so that the clinical faculty and you and your preceptor can have a conference call. And basically we're just finding out, is everything okay? Are we on the same page? Things like that. So now to your clinical assignments. So go down to evaluation criteria, which I'm on page 5 of the syllabus. That's the breakdown of your assignments. There are a fair amount of assignments. We used to have more, and it just got to be too laborious because the theory side is fairly heavy too. As you're learning all that content, you've got tests in there as well. So you've got your first preceptor interview. That's just kind of a fun one. It's just worth 10 points, 2% of your grade. You're going to interview your preceptor and find out how is that person implementing the APRN role. I know some of you, not all of you, are working with CNSs this semester. If you're not working with a CNS this semester, you need to start trying to find one, because you can't do all of your clinical hours with a non-CNS. So, but anyways, if you're doing, if you're interviewing somebody who's not a CNS, just ask how do they implement their APRN role or their advanced practice role, and in there include how do they collaborate with CNSs? Do they know what CNSs do? Do they, value the role of the CNS? Because I know some of you guys are working in states where the CNS role is just barely emerging, and some people have no idea what it is, which is fine because we want to get the CNS role into those states. But so some of these assignments might have to be a little bit tweaked, and that's totally fine. You're going to do 2 reflections this semester, and a reflection, you can use any kind of style of reflection that you like, but to be able to reflect is an important skill. And to reflect, you're going to look at an event that occurred, describe what occurred, why did it occur that way, how do you feel about it, what would you do differently? And it's typically something that might have been a little bit uncomfortable, like I've had students talk about how they were asked to leave a meeting because they didn't want a student in the room during something sensitive, and that was, a little bit difficult. Some difficult family situations, maybe a time where there was a misunderstanding, where like if you're observing the CNS talking to nurses and there was a misunderstanding, things like that. How do you it's an important skill to be able to reflect on something and figure out how would I do that differently next time. So there's 2 of those. One of them needs to be a prescribing reflection. So part of your 200 hours this semester and next fall, you have to spend at least 24 hours with a prescriber, watching how do you prescribe. If the facility allows you to prescribe under the under your preceptor, that's fine. Go ahead and try it. Make sure that you are following the guidelines of the institution where you're at. And some institutions say absolutely not, you have to just observe, but other ones, like when you're doing your undergraduate work, how you're able to administer medications once you passed a med exam or whatever. So find out what the policy is at your site, and if you're allowed to write, and have it co-signed by your preceptor, great, try to do that. Try to learn how to do prescription writing, because that's becoming a role that the CNSs do. So 1 reflection is regular, 1 reflection is on the prescribing role. The next big project that you have, there's 2. One is your teaching project, and the other one is you've got 3 advanced care plans. And they need to be at the level of the APRN. I do have some examples that I can give you guys. But there's a rubric in your syllabus, and I am expecting, this is not your undergraduate care plan. This is you will find a patient with a GI problem, a respiratory problem, and pulmonary and cardiac. GI, pulmonary, and cardiac. So you need to find a patient that is complex, and then develop a plan of care. So, it's going to be more than one nursing diagnosis, and it should include what prescriptions, what medications would you put that patient on. The patient will probably already be on medication, but evaluate, are those medications good? Are there any medications that are interacting? Are there some medications that have side effects that somebody's missed that could be contributing to the problem? That's the way higher level thinking than when you were an undergraduate student or a BSN nurse. You really need to take it up a notch, because you're going to be the expert in the room. So that's what I'm looking for on your holistic plans of care, and try to coordinate it with the content. So when you're in the theory course and you are talking about cardiac, GI, or pulmonary those weeks, try to find your patient to coordinate that, because it'll make a lot more sense. I know sometimes that's not possible, and that's okay, but just try to do that. Your midterm evaluation and your final clinical evaluation, that is a form that your preceptor will fill out. Sit down with him or her at the midterm mark, and that's about the time when I'm going to be doing the phone calls in there. We'll find out how are you doing, what are you weak in, what are you strong in, what do you need to develop. That's what those are, and the form is in there. You're going to give me 4 clinical logs, and it's going to be at the end of each quarter, because you'll see in the content that there's 4 blocks of weeks that you're going to be working on. And then at the very end, there's a preceptor and site evaluation that's fairly easy. So once you go under this evaluation criteria, there's a description of each of these things that I want you to do. So for example, your preceptor interview, that's due on January 20th. And this is what it is. It's just a short 1 to 2 page reflection. That one doesn't even need to be APA formatted. I just want, a report on this interview and answer some of those questions that are there. On page 6 of your syllabus, that goes into a little bit more description about the reflections that I'm looking for. One is due by March 2nd. The other one is due by March 30th. You can do whichever order you want. If you want to do your prescribing first, fine. If you want to do your regular one first, fine. No big deal. And it gives you a little bit of a description about what that prescribing experience should look like. There is a rubric following that for what I want included in that reflection. So for example, you're describing an experience that's significant in some way. And you'll find when I'm grading these papers, as will Professor Miller, I got the rubric right there, and I'm reading the paper like, did the student describe an experience that's significant in some way? So the reflection paper should say, this experience was significant because of X, Y, and Z. Okay, boom, you've met that. So really, really follow those rubrics, because that's what we use to grade. Then the next thing down, and now I'm on page 7, those are your care plans. And those are pretty big papers. And so one is due February 2nd, one's March 2nd, one's March 30th. So try to coordinate that with theory as much as you can. And there's a description of all of that with your what I'm looking for there. And again, there's the rubric that follows. And then I wanted to go down to, and if I don't do this, remind me, because I'll post some examples. I've got some good examples of this that previous students have done. I can post some of that. Then go down to page 9, where it says the teaching project. So your teaching project, we use the plan, do, check, and act model. And this is going to be in 2 parts. So parts 1 through 15 are due on the 2nd. You're going to submit it to either myself or Professor Miller, and we're going to say, yeah, that looks great, go ahead, or hey, you need to kind of tweak this a little bit. If you've got some questions prior to the March 2nd deadline, you might call us ahead of time, like, hey, am I on the right track here? Am I thinking about this right? So that you don't head all the way down a rabbit trail that's completely wrong. So below that is your the grading rubric. So I wanted to point out numbers 1 through 15. So first you're going to plan the project, and so this part of this half, you're going to focus on the patient and the family, or the nurses. So it's kind of what you'll be doing is you're going to look for something that is an issue for patients or families, or perhaps a teaching issue that the nurses are struggling with. Like for example, maybe they have, I'm trying to think of some that we've had in the past. Some of them had patients were post-surgery were not understanding wound care. And so they came up with a plan to sort of bridge that gap so that it would improve quality outcomes with wound teaching. Things like that. I'll have to think of some more. One did looked at pre-surgical stress, and so they implemented like aromatherapy, like using lavender and stuff like that and calm soothing music, and teaching the importance of stress reduction pre-op. So it can be anything. I've had a ton of a ton of different things. So be creative as you're looking around your clinical site for some projects that you can do. And then in this plan, you've got to show me in a flow diagram, this is what's going on. Another really good example is a couple years ago, I had a student who was trying to improve the flow from the ER to being admitted to a bed in the hospital, and it was very chaotic. And so she drew this diagram of the current process. This is what's going on. The flow charts and the routers were not getting to the appropriate people. The length of time was being extended in the ER. The patient was getting inadequate interventions in a timely fashion. So she, and that's what I'm looking for, this diagram that is showing the current process and why it's not working. And then you're going to come up with hopefully a new process of an improved flow or improved process, or like whatever the issue is. So you're going in the first part, in the planning phase, you're going to identify what's the issue that you're trying to address, why is it an issue that needs to be addressed, and where could process improvements be occurring. And this is where you're going to want to bring in some literature. What have other units done? What have other places done to support why you want to do what you're proposing to do? Then you're going to want to try to state your objectives about your new plan. Now, let me tell you something about stating objectives. This is really hard for students to do. Pull up Bloom's taxonomy. You want to keep them kind of simple. An objective has got to be something measurable. So let's say that I wanted to reduce stress in my pre-op patient. An objective can't be to reduce stress in a pre-op patient. What does that mean? Like, what on earth does that mean? Because what stress means for one person might not be for another person. What you could say is, patient will state a reduction in stress 2 hours before going to surgery. You can measure that because you can ask the person before you implement, what is your stress level? 8 on a scale of 1 to 10, 10 being the worst. Stress level is 8. Then you implement your aromatherapy, music stuff, repeat the test and say, what is your stress level now? 4. I can measure that. Patient stated stress was 8, now patient stated stress is 4. I can measure that I have reduced stress. But you can't just say patient will reduce stress. Patient will state a reduction in stress by 2 points, by 2 hours before surgery, but something that you can measure. A patient will demonstrate a lower number on the stress score by 1, or something that you can measure. That's what I'm talking about. So be really careful with your objectives, because I see a lot of students getting tripped up on that. You're going to create a patient education brochure, and it's important that you are using language. It used to be 8th grade, now they say 6th grade or lower, so you be very careful that you're not using big medical ease words and terminology. So in things like post-operatively, you would say after surgery. So just little things like that, that patients are not going to understand. So look through that. You're going to develop something all the way down to number 15. So it's looking really good. You're ready to implement this. You've got a really good plan in place. Then you're going to submit it to either me or Professor Miller. And we're going to say, yep, this looks great, or I need to tweak it. And then you're actually going to implement this project. So this is really a long project. You're going to want to think about getting it started right away, because it's probably going to take you several weeks to get some of this done and collected and created. So then you're going towards the end of the semester, then you're going to implement it. You're going to rewrite a report on how this went, how it was received, what were the outcomes, were your outcomes achieved. So that's your big project that's due this semester. It's worth 52 points. So spend some time on it, and I'm here to help you along the way. APA formatting is huge. Good grammar, good writing is important. This is the 6th edition APA manual. I'm expecting that you are writing in this format. If you've got Office 365 on your computer, if you open up a document, there's a tab on the top that says Format APA. Just click on that and start your document, and it will automatically start transcribing it in APA format. You can also go to the website called Owl Purdue, OWL like the bird, space Purdue like the university, and it's a great super easy website for APA formatting that you can use that. Jill Turner, who also has that CNS library resource that I was telling you about, she's also a really good one to help with that. Then now I'm on page 11 of the syllabus. There's just a midterm and a clinical evaluation. This form, just print it out off of the syllabus. I think I put it on in the week folder too, so you can just print out that document. So if you can't remember where it is, I think I put it in both places. Have your preceptor fill that out and submit that back to me. And those are things that are just going to be due towards the end. Your clinical log sheets, these are due at the end of each quarter. So the first one is due February 2nd, March 2nd, March 30th, and April 22nd. And so you're supposed to have about 200 hours in this semester. So you're going to want to, like at the first quarter, you should be at about 50 hours, and then at the second quarter, about 100 hours. It doesn't have to be cut in stone, but right around there. There's a sample of the clinical log in your syllabus. You can do whatever works for you. What I'm looking for is, when were you in the clinical setting? What did you do there? And this doesn't have to be a dissertation. Rounded with my preceptor, worked on evaluating a patient for my care plan, worked on the teaching project, and then look in the what spheres are there. Like if you're working with a patient, doing your holistic plan of care, obviously you're in the patient realm. Were you helping a nurse who was struggling with a complex patient? Now you're in the nursing sphere. So put in what sphere of the CNS practice you are and how many hours you spent there. And then at the end, you're going to do a running total. That way I don't have to do any math at the end. So like, let's say week 1 you're at 10 hours, and then week 2 you spend another 8 hours. So now put, like 18 hours at the bottom. You're going to put, so I'm not adding it up. And then do that all semester long. So like the first week, maybe you're there for 20 hours. The next week you're there for 25 hours. So now put, I'm there for 25 hours this term / 50. So now you're at 50 hours. So I just don't want to keep a running total. But so you guys do the math and don't make me do the math. But I do double check. So then you sign, and then your preceptor signs it. Then down there, your course policies. Everything has to be due on time, and I've listed all the deadlines in there. If you're running into problems, if you need some help, you just reach out to me and let me know. Say, send me an email, send me a text that you need an extension. Do not send me that you need an extension 20 minutes before the deadline. You absolutely have to think this through, think it ahead. I got sick, my kid's sick, I have, 5 other tests this week and plus work. So, is there any way I can have an extra week? I'm totally cool with that. Just let me know. And, I'm happy to do that as long as I have enough notice. And then I can adjust those deadlines for you. There's just some other clinical guidelines in there. We've already talked about your prescribing experience, how things are graded. 93 and higher is an A in here. It's a fair amount of work, but I expect that most of you guys will get A's and A minuses, as long as you're working hard and submitting quality work, APA formatted, good writing, good grammar. If you need help, we have a disability support services on campus. You will get kicked out immediately if you try to plagiarize or cheat through this course at all. So just Don't do that. We are nurses and we are one of the most trusted professions, so let's keep it that way. Integrity is very important to me. So if you ever have any issues, just let me know. Title IX, if you ever feel uncomfortable or threatened anyways, we've got a Title IX office. And then following all of that is the topical outline, more clinical assignments, and what's due when. In the topical outline,